Dr. David Shulkin is a board-certified internist and served as chief executive in prominent hospitals. He was the ninth Secretary of the U.S. Department of Veteran Affairs, representing 21 million American veterans. He was responsible for the nation's largest integrated healthcare system, with over 1,200 sites of care. Thank you for joining us, sir. Please go ahead, Dr. Shulkin.
Great. Thank you. And I appreciate everybody who's joining the call today. I know some of you have experience in working in VAs. Many people have trained in Veterans Affairs hospitals. Approximately 70% of all American physicians have done part of their training in VA hospitals. So many of you will understand some of the things very intuitively that I'm going to be talking about today. But for those of you who are in the community, I'm sure that you have many veterans in your practice. And just to give you a sense about the way that the current VA works is there are two systems, the VA care that's delivered within VA medical centers and then VA care that's delivered in the community, which means these patients come see you and VA pays the bill. That's approximately 42% of all care now in the country is provided by community-based physicians. So the first slide that I have is a picture that many people will recognize. This is the World War II pictures, the pictures of the old GIs. And in fact, the government would give 12 cigarettes a day to each GI as part of their general ration. So you would get your food and 12 cigarettes. And those veterans that didn't smoke would trade them for other things. But it was very typical to see a veteran, particularly those who were exposed to a lot of stress, with a cigarette in their mouth. And because of that, veterans are more likely to have lung cancer than the general population, about 25% more. And again, that's important for you to understand as you're caring for these people in the community. But also, in addition to having a higher risk, the survival rate has historically been lower. And that probably is because of later diagnosis and more severe types of cancers that present. So this is a issue that's of deep concern to us who care for veterans. On the next slide, I wanted to just talk about the way that VA has handled medical and lung screening, particularly given this higher incidence of smoking, this higher incidence of lung cancer, this worse outcomes that are seen in the veteran community. And so VA has long had the recommendation of the United States Public Health Service of doing annual screening for veterans 55 to 80 with a 20-year PAC history. And so this is consistent. It's what VA will pay for in the community, and so very similar to what you're seeing with your other patients. Now, next slide, please. When the next slide, please. When the pandemic hit, I think many people felt that it was not possible to do as much in-person screening, that it was more difficult to counsel people. And so the VA, like many others, went very, very quickly to telehealth. When I was secretary, I'm a general internist. I always saw veterans, and I saw veterans in person in New York City, but from my office in Washington, I would see them using telehealth. This is actually a slide where I brought my telehealth equipment to the Oval Office at the White House. I asked the president for special regulatory authority to be able to allow all VA providers to be able to use telehealth to cross state lines, in other words, to use federal supremacy so that we could reach as many veterans as possible. And as you probably know, about 45% of veterans live in very rural areas in the country. So getting access to providers to talk about screening, to arrange for screening is challenging, but telehealth was a very useful tool for us. And actually, CMS or Medicare followed our regulatory relief in the pandemic from the way that we laid this out with the president for veterans. Next slide, please. So there are approximately 1.5 million veterans that meet the criteria for lung screening. That's a lot of people to try to get through the VA system. VA, as we'll talk about a little bit, is challenged in getting all those through, which is why you'll see a lot of veterans in the community that are going to be in need of lung cancer screening. Next slide, please. Now, how does the VA do in terms of performing lung cancer screening? Well, not actually all that well. When you're a federal agency, you have federal watchdogs that look at how you're performing. And the Office of the Inspector General of the Department of Veteran Affairs came and reviewed how the VA was performing in terms of lung cancer screening. And what it found was, of those veterans that they were screening, that the follow through in terms of getting the results back to the ordering physician, getting the follow up that was needed, particularly when results were abnormal. And about 13% of all 13% of facilities had abnormal results in their lung cancer screening. But what the Inspector General found was that about 21% of patients that had an abnormal test, that their doctors weren't notified of it, and that there were not follow-up of those results within 14 days, which is the standard of VA. So VA has struggled in terms of being able to not only perform these exams, but get the results back so that follow-up can be done in a timely fashion. These types of reports help the VA put in more stringent programs, get better. But I think it's important to recognize that when veterans are seen in the community, that making sure that these results do reach a provider, if it's back at the VA or if you as the physician are going to be the follow-up provider, that it's very important that those abnormal results get followed up. Next slide, please. Now, in 2022, something pretty significant happened for veterans across the country, and that was that Congress finally took up the issue of burn pits. And if you don't know about burn pits, it's because burn pits are not legal in the United States. But as you know, many of our military serve outside the United States where there are not as strong environmental laws, and particularly in war zones like Iraq and Afghanistan during this last conflict, 21 years of conflict. What the US military would do is they would just simply set up a dump right beside a base where our soldiers were, and they would burn all the trash. Sometimes that was jet fuel, sometimes it was environmentally hazardous materials that were in waste, sometimes it was sewage. Whatever needed to be gotten rid of, they would burn right next to the bases, and that smoke would all day long be on the bases, and our men and women in uniform would breathe the burn pit exposure smoke day and night. And as you would imagine, a lot of difficulties resulted from that, and especially respiratory issues. Now, while we went into Afghanistan and Iraq, as all of you will remember, after September 11th in 2001, I talked about this issue not being addressed by Congress until 2022. So for 20 years, the VA and our government really did nothing about burn pit exposures. And so veterans would continue to come back with all sorts of complaints, respiratory complaints, cancers, and others, and would have to fight their government for proper evaluations, healthcare, and benefits. Many of them, of course, lost that fight and died during this time. But in 2022, a number of us really stood up and said, well, if the VA wasn't going to do this, Congress needed to give our veterans these rights. And that's where some of you may remember, not necessarily me, off to the right, you can see that's me and Senator Gillibrand of New York talking about why we needed to get our veterans regulatory help for burn pits. But finally, John Stewart, off to the left here, took on this cause. He had taken on the cause for 9/11 first responders and then saw the similarities with our veterans and took on this cause. And when Jon Stewart got involved, the national attention focused on it, and then Congress focused on it. And in 2022, Congress passed a law giving our veterans added benefits for anybody exposed to burn pits. Next slide, please. The president signed the burn pit exposure law in 2022. He believes that his son, Bo, who served in Iraq and Afghanistan, actually died of burn pit exposure with a brain glioblastoma. And so he was very supportive of the Burn Pit Exposure Act. Now, what that said, next slide, what the Burn Pit Exposure Act said and what it means is that while the issue of all of these very toxic respiratory exposures has been studied for decades, the VA had not been willing to grant benefits or health care for these exposures until there was absolutely proof with scientific data suggesting that there was an exposure between breathing in all these things for years and the cancers and the respiratory diseases that veterans developed. What the law said was that we're going to give the veteran the benefit of the doubt. If they have developed these terrible respiratory diseases, these cancers, they can show that they were in areas where burn pits were, we're going to presume that these conditions are related and we're going to grant them benefits and health care. And so that's called a presumptive. Next slide and last slide. So effective in April of 2022, veterans now have what are called presumptive conditions where they are given the benefit that if they were exposed to burn pits, that 9 additional cancers and up to 20 other conditions, respiratory conditions, from asthma and sinusitis on the mild side of respiratory to severe respiratory conditions like chronic obliterans, are associated with burn pits, and therefore veteran healthcare is covered, veteran benefits are covered. And so you will now see veterans coming to you with what we talked about in the beginning, that additional exposure to cigarette smoking, giving them a higher risk for lung cancer, 25% higher, many more of them than the general population. Now add on top of that the burn pit exposure, which over 3.5 million veterans have returned from combat zone areas overseas with burn pit exposure. So you will see a lot of those as well, with connections to these respiratory conditions. Both of these, lung cancer and burn pit respiratory exposure, called post-deployment respiratory syndrome, are good reasons to do screening, lung cancer screening, low dose CT scan screening, and other respiratory evaluations on veterans. And with that, I think I'll stop because I really just wanted to make the point that you'll be seeing veterans in your practice. They are at higher risk for respiratory conditions from both traditional exposures as well as these burn pits. These are recognized associations now, and it's very important that we get our veterans the right type of screening and then follow-up results back with VA doctors who know about abnormal results or with other doctors in the community who can follow up on those results. So I think I'll stop there.
Thank you, Dr. Shulkin.